All right, we are live with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you again for joining us, Doctor.
Thanks, and hope your day's going well so far.
So far, so good. Today, we've got a ton of questions again for Toronto's Associate Medical Officer of Health. My name is Dilshad Burman. I am a web writer with CityNews and 680 News, and I will be moderating this chat today. So let's get started right away. Lots to get through. We'll start with some travel questions. People are looking to travel now that things are opening up. So let's start with Brenda. Brenda says she's planning to fly to Toronto from Vancouver this summer, and she's unsure if she's supposed to quarantine for 14 days once she gets here. She's kept her bubble very small in Vancouver, under 10 people. Same for Toronto, it's going to be under 10 people. But then does she also need to quarantine after getting back to Vancouver? There seems to be a lot of information about international travel, but not interprovincial.
Yeah, so that's a good question. Right now, there are no restrictions coming into Ontario from other provinces. So if you're visiting Ontario, you don't need to quarantine. And if you're visiting Toronto, though, and going back to your province, you'll have to check with your provinces. Some of the eastern provinces did have restrictions. As far as I know, Vancouver and BC doesn't have restrictions. So meaning that you won't have to quarantine when you go back, but it is certainly something that's worth clarifying before you go, because you don't want to find that there's something new that you have to follow. But for Ontario itself, if you travel within Canada, you do not need to quarantine for 14 days when you return.
Oh, okay, that's great. And then I guess John C. Pretty much has the same question. Is there any provincial or federal government directive or regulation that would require me to quarantine myself from my workplace for 14 days if I traveled from Ontario to BC by plane?
So if it's a workplace specific question, you should confirm that with your workplace. Mm-hmm. But in terms of public health advice and guidance for restrictions, there aren't. Sometimes in healthcare settings, there can be more strict restrictions. And so you should just check with your workplace to make sure that it's okay for you to travel. I know that a lot of workplaces in healthcare actually want to know if you are traveling, where you're going, and to be able to offer you that guidance.
Right. And then a related one to the 14-day quarantine rule, Grape1 asks, when do you anticipate that the 14-day quarantine rule will actually be eliminated?
For travel, right now, travel outside of Canada requires that 14-day quarantine unless you have a particular exemption. So for example, truck drivers or certain essential workers do have exemptions. You can see that the virus continues to spread around the world. And we know that in March, a lot of our cases were related to travel. So travel, when it opens up, will continue to be higher risk. And so I think we can imagine going forward, we will have some sort of restrictions or quarantine related to travel, but we'll have to see as things, if the border opens up, if we allow more travel, what the recommendations are at that point. But anyone coming into Canada from abroad is required to quarantine for 14 days unless they have an exemption.
Right. Lots of mask questions as well again this week. So let's start with Ed. Ed says that he's heard stories about small particles of COVID-19 floating in the air for several minutes. So that's the discussion we had about airborne last week. So his question is, does he need to wear a mask while he's exercising outside, just walking for an hour? There's not too many people around when he's walking.
So we don't recommend that you wear a mask when you're exercising. And also being outdoors, if you're able to physically distance, you do not need to wear a mask. This issue of the smaller particles perhaps being airborne, I mean, we have talked about this for a number of weeks, that it's those smaller particles that can be suspended in the air for longer before they fall to the ground, but don't necessarily linger for hours and hours. Again, we'll know more as we're doing more studies and evaluating the science. And so what that means, though, is that indoor settings can be higher risk because that ventilation, that constant through of air is not there. And so a smaller particle might stay in the air for longer compared to outdoors. So if you were exercising outdoors, you were able to keep a physical distance from others, you would not need to wear a mask. That would be fine.
Okay. Actually, Tina had that exact same question as well. So Tina, I hope that answered your question as well. And then Elle asks, and this is a really interesting one. Is wearing a non-surgical mask sufficient when undergoing close contact medical exams like an ultrasound or a mammogram?
So the most important thing when you go in these places, when you're having these procedures done, actually is the screening. And so before you actually go to these places, they should ask you to make sure you don't have a cough, fever, you're not feeling unwell. That's actually the first line of defense when you get in there. And then when you're in there, each of these healthcare facilities will have their own guidance for what you need to wear. But in general, a patient receiving those services would be fine to wear a non-medical mask. It would be the same thing if you were to go to an emergency department. They would not provide you with a medical mask. It would be a non-medical mask there as well.
Right. Okay. Kathy asks, can I wear a seal plastic mask instead of the regular mask? I'm not sure plastic is the most breathable fabric.
Yeah, so I have seen these. They're kind of like face shields, but they're like a mask only. And I think there are a number of things to consider. If it covers your nose and your mouth, and your chin, it's not gaping, well, then I don't have that actually covers the requirements in the mask bylaw and is important. If you were to cough or sneeze, it would capture it. I think what you would want to find out is, can you tolerate it? Can you breathe through it? Does it feel comfortable to you? But also after you use it, to make sure that you dispose of it. I don't believe that these things can be properly cleaned. Mm-hmm. And if you're planning to reuse it, you have to make sure that it's a reusable type mask and that it's cleaned and sanitized properly or disinfected properly, because a cloth mask, we know that you can throw it in the laundry and clean it, but I'm not sure about these other types.
And then one more question regarding types of masks. There are some masks that have these valves on them that seem to, I don't know if it's for better breathing or whether it's for filtration. Are those as effective if there's basically like a hole in the mask?
So there shouldn't be an actual hole in the mask. I know that there are certain masks have a layer where you could put a filter paper, for example, as you said, some sort of filtration. So, but the mask should itself cover. There shouldn't be a hole in the mask. If it's actually an outflow valve or something like that, that's something to know. But again, there haven't been any studies to necessarily say that those are better for you. And we're certainly not recommending that you have to wear a mask that has a filter paper or something through it.
Okay. Jean asks, I have contracted COVID-19 in April. Some studies are contradictory concerning the risk of whether or not you can get it a second time. So he's asking your opinion. Do you think that you can basically get COVID-19 again after a few months?
I think it could be possible. I mean, I wouldn't say that it's not possible at all. Mm-hmm. It could be, it depends. We're not quite sure how long your immunity will last. It may only last for a couple of months. We know with something like influenza, you can actually get influenza every year. Right. That's why you need to be vaccinated every year. Mm-hmm. And so I think just because you had it doesn't mean that you should feel like you're now protected forever. And you're still going to need to take those same precautions. And as well, if you have symptoms, you will still need to get tested. Right. But but I'm not aware of any definitive proof that reinfection is possible. But given what we know, again, we only know from people who have been infected since the end of December, really, until now. And so it's something to watch for.
Yes, and we don't really have any reinfection numbers per se, right? Right now, we're just counting new cases.
That's right. And there's two things here. One is if you've had an infection and within the last 90 days thereafter, you get tested again, but you don't have symptoms. It could be that you turn positive, but it doesn't necessarily mean that you've been infected again. You're still shedding old virus compared to those who had it, and then they actually get symptoms again and are tested and are positive. Yeah.
Yes, you mentioned this. So there's the 14-day recovery period, and then up to 90 days, you could be shedding the virus, which means that it could still be in your system.
That's right. Yeah.
So I think actually this one is you've probably just answered this, but I'll ask it anyway.
Yeah.
Rob asks, I'm curious to know if someone suspects they may have contracted the virus but never got tested, how long does the virus stay in their system to still represent a possible contraction by someone else? So I guess how long are you contagious?
So you're contagious, we say up to 14 days from when your symptoms started. If you never had symptoms, then we use 14 days from when your test was done. And after that, the vast majority of people are no longer considered contagious. The only caveat is if you were very sick in hospital, it might take you longer in order to clear the virus. But for most people, it's those 14 days.
Okay, and these are two similar questions from Christine and John. Christine asks, where do I go to be tested if I think I had the virus in late February?
So right now, there's no way for you to get tested to see if that's what you had in February. I think actually I've heard this question on in a number of different places to say, well, maybe what I had in March, that illness that I had was actually COVID. There's a couple of things that I can say about that. While not everyone was able to be tested early on in the outbreak, we still did have a lot of testing going on. And we still know that for all the tests that were done in the beginning of March, the people who actually had symptoms of COVID and were tested, maybe even had travel, less than 10% of those people actually had COVID. And so we still know that even early on in the outbreak, there were other viruses that were making people sick. We're going to have to see if antibody testing might help us to determine if that's what it was that we had. But even still, even if you were to be able to pinpoint and say, well, that's what I had in February, if you're not clear how long your immunity is going to last. And so it's probably not going to help you very much going forward.
And I believe currently the antibody testing that is happening is trying to determine that exact thing, that even if you have the antibodies, how long are they going to last? Are you still susceptible? And those studies are still ongoing.
That's right. It's not definitive by any means.
Right. So similarly then, John asks, I had COVID-like symptoms in early December. Should I get tested to see if I had or still have the virus? So that's the same.
In early December, we don't think that we actually had COVID. We know in Toronto, our first case was January 25th, and it was related to travel to Wuhan, China, where the first cases were identified. I actually don't think that we had COVID in Canada in December, because you can see how without public health measures, COVID can actually spread quite rapidly. And so if we had it here but undetected in November, December, you could have imagined that we would have by January and February had many, many cases of people getting sick with maybe something we weren't sure of. So I think that's one thing that I can say is the first case in Toronto and even in Canada was on January the 25th. And we know that that person was put into quarantine right away and didn't result in any further spread.
Okay. This is interesting. I'm not sure if we have these statistics. VCS asks, what age group is now contracting COVID-19? Have we seen like a shift in the statistics? Is it younger? Is it older?
Yes, we have seen a shift in the statistics actually. So we know early on, we actually know that many of our cases were related to long-term care homes in particular. And those people who live in long-term care homes are actually older. And so that's why we were seeing many older people who were getting infected. But we've actually, through our interventions, which is actually really amazing, the outbreaks in long-term care homes have actually come under very good control. And the cases in long-term care homes are actually much, much less than they were. And so what we're finding now is actually that it's younger adults who are more likely to get infected. Overall, for all of the cases we've seen, actually the 50 to 59-year-old age group had the most cases, but we're starting to see more children with the infection, more 20 to 30s, 30 to 40s who are getting infected. So the age range is certainly getting younger.
Okay, that's very interesting. And again, a warning for people to continue doing what we're doing.
Exactly. And a warning for young people who may think, oh, that's something that we dealt with a couple of months ago. We had the lockdown for that and it's not an issue anymore. And actually it is. And you drop your guard and you're going to get it.
Yeah. So Alkesh asks, I believe we've covered this before, but good to reiterate again. Alkesh asks, how many strains of COVID-19 have so far been identified? And if so, has one strain caused more mortality than others? Could there be some areas that have a more nasty strain and therefore they are seeing more devastation?
Right now, we're calling the virus that causes COVID-19. COVID-19 is the disease. The virus is called SARS-CoV-2. And as far as I know, there's only one strain related to that. Now, what can happen is the DNA or the genetic makeup of this virus, sometimes in viruses, certain nucleotides can change and adapt, but it doesn't necessarily mean that the strain has changed. They're just small mutations. So right now there's only one strain. And I think we're still waiting for the science to tell us, are some of the strains more serious, more virulent? That's our medical term to say that it causes more severe illness. Yes. Or is it the same strain? It's the person who got it who was more at risk for severe illness, and that's why they had a severe illness. This is what we need to sort through.
Okay. This is also an interesting one. Tina asks, if I touch something that has the virus, but I don't touch my face, am I safe?
Yes, the virus is not going to spread through your hand. It won't absorb in your hand and infect you in that way. The only way that it will get into you is if you actually expose what are called your mucous membranes. So classically your eyes, your nose, your mouth. That's how it would. That's how you could then turn it into an infection or incubating infection.
Right, right. Oh, here, last week we had a question on gyms, and now we have another one. It was a very popular question. So Nico asks a question regarding gyms. On his gym's website, they've posted a statement saying that floor fans and mounted fans will be turned off in order to prevent any unnecessary air movement, but the ceiling fans will be on to provide proper ventilation. So he asks, do you think this is a safe protocol? Because it's confusing to him because one of those fans are on, but the other ones are not.
Yeah, so we actually have guidance that we're working on to provide gyms for when they'll be able to open in Toronto. The ceiling fans are are actually good to increase ventilation and are not a higher risk. What we've seen in the literature is it's when the fans actually are directed onto a person and the fan can then contribute to spreading those droplets further. That's the kind of fan that we don't want. And so we say even fans that are in a room, point them to the walls, point them down, point them up, but don't point them so that they can kind of recirculate droplets from people to other people.
Okay, that makes sense. Laura asked, and again, I guess we've just covered the age question, but is it true that only elderly people can be contagious? And how are healthy people becoming infected?
No, it's not true that only elderly people can be contagious. Actually, anyone who has the virus, 48 hours before their symptoms start, they're contagious. Up until right now we're using 14 days from when the symptoms start. So you're actually contagious, we say, for up to 16 days. And so that's why we're actually recommending you wear a mask, because you won't know 2 days before your symptoms start. You're going to feel just fine and you may carry on. And that's why it's important to do some of our measures, because you can't always tell when you may be contagious to others.
Right.
So that was the first question. What was the second question?
So she's asking, how are healthy people becoming infected?
Right. So healthy people are becoming infected because they've been exposed to someone who has the virus. And essentially, they're not keeping that 6 feet distance between whoever they're having conversations with or whoever they're hanging out with. And someone is contagious with or without symptoms, and that's how they're getting exposed.
Okay. I guess this is about the test. It's interesting. Clayton asks, why do you need masks if the virus is at the back of your throat? Because when they do the test, they do the swab up your nose or in the back of your throat.
Yeah, so the reason why they do the swab, it's called nasopharyngeal, and we do it right at the back of the nose, is because that's where we can reliably detect virus. But there are actually swabs that do throat swabs, saliva swabs. So the virus can be anywhere, kind of in the head and neck type area. And so if you sneeze, you can imagine that the virus that's in your nose will come out if you're coughing, if you're talking. So that's why it's spread through those droplets, and those droplets, even if they're in your mouth, can have the virus in them. But we do the test at the back of the nose because that's where the virus more readily sits. And so we're more confident that if we do the test there, if it's negative, we can say, well, probably you're not infected.
Okay, so Paul, I guess, has a similar question as well. Why do I need the swab through the nose to the back of my head when my saliva can spread the virus?
Exactly. So there are some tests that use saliva. We don't have those available right now in Canada, but they're likely to be coming. They're certainly available in the US. And as I said, some places you can do it, even just a nasal swab, not a deep nasal swab, or a throat swab as well. And I think as we do more of these tests, we can figure out, well, actually, what is the best test to be able to do.
Right. And I think when he says, your saliva can spread it, that's not necessarily the saliva so much as it's the virus that is sort of from wherever the back of your nose is carried through your saliva, right? And so
right, it's the virus that's in your body that's contagious, and so it's in many of your cells, including your saliva, your nose, and all kinds of places.
Right. Okay, Nathan asks, regarding mask rules, why aren't we enforcing the mask rules? And if we're not enforcing it, why are we passing it in the first place? Because it's people are going to disobey it and conflict is going to happen.
Yeah, I mean, the reason why we have a mask bylaw is because we want more people wearing masks. I mean, that's the bottom line. And we know that we've had a strong recommendation. I've talked about it, in June many times, that Toronto Public Health strongly recommends that people wear a mask, especially when you can't physically distance. And so we saw many people wear masks, maybe even 50% were wearing masks with that recommendation. But we need more people wearing masks to really make an impact. There was a recent study that was published by the Centers for Disease Control that looked at in a hair salon. And everyone was wearing a mask and nobody got COVID. And so I think what we realize is, if one person wasn't wearing a mask, maybe that person might have gotten it. And so I think that's the reason why we have the bylaw, is because we need more people wearing the mask. In terms of enforcement, there is enforcement related to the bylaw. There certainly are fines that can be passed out. Right now, what we want, though, is that businesses have a policy that they follow the bylaw, and to use education right now to get people up to speed on what the requirements are to ensure that we get more people wearing masks. That's really our goal.
Right. And I mean, businesses technically are able to say, no, you cannot enter without a mask. They are able to refuse service if they so choose. So that's
right. Businesses are able to adopt their policy, and that's part of the bylaw to decide who can and can't enter. But they are required to have a mask policy for sure.
Okay. And I feel like if you're going out and about and entering various businesses, that's going to be reason enough for you to put a mask on. If you want to go shop, you got to put a mask on. I mean, that should be good enough reason.
Yeah, I think it's part of our new normal that, going shopping, even to do basic errands, can be risky. And when we wear a mask, we're also protecting those, grocery store workers, retail workers. We're protecting them as well. And they need our protection.
Absolutely, because that might be the only interaction I have all day, but I'm probably the 150th person they've interacted with all day, right? So definitely.
That's right. Yeah.
Okay, this is a good one. We had this last week, but definitely good to reiterate. Carrie asks, I'm worried about all of the farmers that are testing positive for COVID-19. Is our farm fresh food safe to eat after being harvested by somebody with the virus?
The short answer is yes. There's no evidence that COVID-19 is spread through food. We also know that people who have tested positive on the farms are required to isolate and to wear precautions as well. So the likelihood of them infecting our food when they're contagious is low. But even if they did, there were a few virus particles that were on food that was harvested, for example. We know that the virus doesn't last on surfaces forever. And so by the time it goes from the farm to when you might choose to eat it, the virus might have died by then. But we also know that before you eat your food, we're still telling you to run it under cold water, and that also will help to remove any virus. But we also know that even if you were to ingest it, even if you were to eat it and it had virus, it's not likely to make you sick.
Right, because ingesting that's not how you catch it. You catch it through the ENT system, ear, nose, and throat.
That's right.
Okay. So, and because we've had this so many times about ingesting it, and I think people are so used to, if you eat something, you get sick, like your stomach gets sick or you throw up or whatever. But this is important to know. If you eat something, you're not necessarily going to get COVID.
You're not necessarily going to get COVID. You could get other things.
Right.
And yeah, but probably
that's why
not.
you wash your vegetables.
That's right. Right. You're doing it for more than just to prevent against COVID.
Right. Absolutely. Okay, let's see, what else do we have? This is an interesting one. Kamala asks, various different countries are developing vaccines. Lots of them have had trials and things like that, and we're moving at a fairly fast clip. But how do we know which is the best one?
Well, the COVID vaccines, I'm not sure that they're going to be tested vaccine A versus vaccine B. Right now, they'll be testing a COVID vaccine versus a placebo because there is actually no standard vaccine that is available. And so once you have a vaccine that shows that it works compared to nothing, and if it's approved by Health Canada, I mean, we'll have to see which vaccines are actually available in Canada. Just because you have a vaccine that's available in another country doesn't necessarily mean that that same vaccine will be available in Canada.
Right.
But you can imagine a few years down the line that we may have multiple vaccines for COVID and could decide which vaccine worked better. And I think that there will be scientific analysis that we can do to help determine that. We actually know that for certain vaccines, that some vaccines actually do work better than others. And that's something that we can hopefully we'll be able to have that choice in the future.
Absolutely. I mean, that all just comes down to even one vaccine getting, through the trials and approved first for human, testing, and then of course consumption. So fingers crossed.
Yeah, that's right.
Okay, this is also, I guess, another good one. Why can I not go to my general practitioner, to my GP, but dentists are working with droplets flying all over the air?
You should be able to go to your GP or your family physician. And, certainly we're asking family doctors to be open in order to provide, for example, vaccinations to young children to make sure that they stay up to date with their vaccinations. Whether you go to your family doctor or you go to a dentist, you will have to take precautions. And so that'll include screening over the phone, wearing a mask, not coming when you're sick, or if you're sick, having special protocols to be seen in a way so that they don't prevent spread to others. But there's nothing to say that family doctors' offices need to be closed. So you could certainly find out from your doctor if they're choosing to remain closed when their plans are to open the practice.
Okay. Yeah, because that was a few people asked that question, like, are doctors mandated to stay closed right now? And
no, part of the reopening is to be able to have healthcare facilities open, to be able to do things that were before considered non-essential, to be able to have those clinics and stuff opening up.
Okay. This is a good one. Anna asks, can you offer input on the expected severity of the flu this fall due to all the protocols in place for COVID-19?
Right. So it's actually a good question, and let's hope that the flu will be less severe because more people will get vaccinated, and because of all the precautions we're taking, we'll actually also stop the spread of flu. I think that certainly is the hope. Flu spreads in similar ways to COVID. They're not identical viruses by any means. So that is the hope. I mean, it's not just flu that spreads in the fall, unfortunately. There are a host of other viruses that spread. And so having these precautions in place, hopefully we'll be able to prevent the spread of many of them. And we'll have to just wait and see.
Couple last ones. I think I can squeeze in maybe two more. We have 2 minutes. Ferdinand asks, when a barber is cutting your hair, should he or she change the mask between clients?
Not necessary, no, because the idea is that the mask he's not touching the mask, but while he's providing care to you. And so I think the more important thing, if he touches the mask, is that he washes his hands, but the mask itself being on between clients should not interfere or prevent or contribute to any spread, because the mask itself can't spread droplets.
Okay, and then we'll do this last one. Timothy asks, how come wait staff can serve beverages and things like that, but businesses like hair salons and other personal care businesses can't serve you food or beverages? What is the difference?
So in a personal service setting like a hair salon, we've asked that they don't serve food and drinks during COVID because it just increases the risk. There could be contamination on the water bottle or the glass. And we just want to be able to reduce as much risk as we can. And so we're talking a lot, you've heard a lot about essential services, the bare minimums, not have extras. And really all of that is to be able to prevent as much spread from contamination as we can.
Okay, and of course, I mean, in a restaurant, obviously that's what you're there for. That's why they're serving you beverages. That makes sense.
That's right. That's right. Yeah, exactly.
Okay, well, it's 1 o'clock. We got that last one in just in time. Thank you so much again, Doctor, for joining us and answering all of these questions. I'm sure we'll have tons more next week as well. So we'll see you then.
Okay, great. Thanks. Bye, everyone.
So much. Bye-bye.
Bye.